In this episode of the Blood Clot Briefing, Louise speaks with Dr Amman Sharma about weight loss medications like Ozempic and their potential link to blood clot risk. They explore the benefits, the concerns, and what people with clotting risk factors should know before starting treatment.
So, weight loss drugs and blood clots. I'm here on Thrombowatch again with my good friend Dr Amman Sharma, and we're going to have a look at this situation. Is it risky? Dr Sharma, what do you think?
I would say it's a trend now, isn't it? To look slimmer, to look less overweight.
I wouldn't have any of the weight loss drugs, partly because of my history and my genetic risk factors for blood clots. I've heard there is an association.
Absolutely.
Can you debunk that, or can you
Absolutely.
confirm it?
So let's firstly talk about a bit about obesity, right? So the way we quantify someone is obese is checking their BMI. So what essentially happens is the higher the BMI is, the amount of cholesterol, that the amount of fats that would be getting deposited in your body would be higher, thereby increasing your risks, of course, for cardiovascular problems, for clot problems, for overall bones and everything. But now the trouble is, because of this medications, right, it has a good part to it, but it also has a very dangerous part to it. The dangerous part comes in because at the moment, if I were to lose weight, so my BMI is about 27, 28, something like that, but I want to look more slimmer, right, for any bizarre reason. I could go to the gym, hit the gym, do the dietary modifications and this and that, or I could take some injections which might make me lose weight and look a lot slimmer, lot younger, and who knows, maybe be a model someday or something. But now the trouble is, again, because see, in the NHS there's a very specific guideline who can have these medications, what medications can they have, what are the side effects, what are they going to gain out of this along with this. Okay, so at the moment, anyone who's got a BMI of more than 35 can be offered these medications. In the NHS, they are usually offered a drug called semaglutide, which is going by the name of Ozempic or Wegovy, right? So these are the injections you take into your tummy. They work in a way that they mimic the body's enzymes, thereby increasing the insulin production, reducing the glucagons, and thereby reducing your insulin, but also reducing the amount of chubbiness that you have, the amount of weight that you're carrying in the terms of deposition of fat. Okay, it might look nice if I'm saying, oh, everything's nice with it, but it's not actually. See, all of these medications do come up with side effects, right? So you would have gastrointestinal symptoms, as in most of the people do report bloating and diarrhea and stuff. Again, someone who's weighing 35 BMI, they're at least weighing a couple of 100 kilograms, isn't it? So their water intake needs to be a bit different from a normal person who's weighing 70, 80 kilograms. The body activities also need to be different. The amount of calorie that they are taking, the amount of food they are taking, the amount of carbs and things that are in their diet also plays a part. So again, when we talk about people taking these injections, it's very easily available over the counter now. So people would go to the big pharmaceutical stores and say, I want to get a loose pill which, or the injection which might lose my body weight. Again, we've got a newer drug now, is tirzepatide. The most common brand names are, of course, Mounjaro, as we know, but there are a couple of more brands in the market as well. So the drug itself is not bad. Okay, it's the way we have utilized these drugs out of proportion just for cosmetologically looking slimmer. So what we are fighting here is a sort of obesity, but with cosmetological intent. Not to
Yes.
get rid of the obese. You were obese, you were earlier. Your friends were still your friends. Your family still loved you. Your kids still loved you. It's nothing like that has changed with you getting more and more obese. But yes, the lifestyle definitely suffers a lot because your risks of having blood clots also increases taking the medication, but it also increases if you're getting massively obese. So I was going through the literature. It was published by some guys from Middle East, and they had a 20-year-old young lad who was over 35, and he was started on the medication, and he developed a blood clot in his legs. No obvious predisposing factors, but he developed, and it was reported as in the medication itself was directly responsible to it. Again, these medications are still in their very early phases. We need lot of study, question here is what's healthy for you and what's not.
I have actually heard that maybe the rapid weight loss can
Mhm.
also cause a clot. Not quite. So take the drugs, it has the desired effect or the prescribed effect, you lose the weight. Could you be getting a blood clot because of the rapid weight loss?
So good question. So again, you have to be very watchful for what you're trying to achieve here. Okay, people who've got diabetes, who've got a number of conditions, for them, weight loss might be a blessing. Okay,
Yes.
because it helps them in so many ways. Whereas,
Joints.
yeah, everything's affected. But like for people who are fairly healthy, other than them being overweight, right? As I said, we live in a crazy world now where the slimmer people are considered as healthy. People like me, you are considered unhealthy because yes, we are not in shape as per the terminology of what people describe, isn't it? Again, you are losing weight at a very rampant pace. You're overdoing things now because you want to maintain it, because of course the moment you quit these injections you'll get back to your baseline in couple of months. So you're going to the gym, you're hitting the gym like anything, right? You're taking these pills or injections and you're doing a sort of very robust diet plan. So you're restricting your carbs, you're restricting your calories, you're restricting this, you're taking high amount of protein. But where's your water? It's still the same. You're still taking a liter of water and expecting your body's need not to go up is where things go wrong.
Okay.
I feel
Understood.
it's a whatever has been reported, it's a fairly good mismatch between your intake and your hydration status, and you putting yourself into these completely stressful conditions in a way I would put that.
I talked at the beginning about the fact that I wouldn't take them personally
Hmm.
because I know that I have Factor V Leiden. Is it something that people should maybe be aware of? Is there a question around, do you have a history of blood clots in the family? Do you know if you have Factor V Leiden? Could you even, if you're going to pay for these drugs privately, would it be sensible to pay for a genetic test to just check out your likelihood of having a blood clot as
Very
well?
good question. Very good question, Louise. Of course, people who've got blood clot related risks, they will always be at risk without this medication, with this medication. But again, whether these medications are directly precipitating a blood clot or who can have it without any fear of developing any side effects. As I said, when you are being examined in the NHS, within the NHS, yes, they would usually go this very strict pattern of screening, whereas we would make sure that there is no underlying obvious precipitating factor that would lead to a blood clot. Because where if you are overweight you will have diseases, but if you get a clot which is fairly acute, that's potential life threatening. So if you do the risk versus benefit, so of course, someone who has got a clot is going to die with more risks when compared to someone who's obese, because that would be a slowly progressing condition. So unfortunately, it's very easy to procure these medications now through the internet. All you need to do is online surveys and stuff. There's no obvious, I would say, good consultation platform on that. So that's how it becomes a bit risky, because you're not screened completely. You don't know what your risk factors are, and you're jumping on the ship with the other people just to look slim cosmetically, not in real terms. That's what carries the biggest risk. And unfortunately, when you open up the social media platform, even I'm tempted to start it.
Me
I'm,
too.
I'm not gonna lie.
Tempted, but no.
Yeah, because I'm not saying I'm massively overweight. I'm 90 kilograms. I'm 5'11", so that's still okay-ish, I would say. Yes, bit on the higher end. When I've seen a couple of my friends, they've lost weight like anything, and they definitely look a lot younger to me now. So I'm like, oh man, should I give it a try? It's just, and also the money that's involved with them, because initially these injections were quite expensive, but now the money is also coming down. So someone who might think, oh, I'll do diet and I'll go to the gym and do this, I'm going to spend about 200 pounds a month. Oh, let's get these injections. I think that trend is dangerous.
Yes.
And you're seeing more and more younger people using these medications without any comorbidities, without any complex medical conditions, just look, what to say, slim.
So I think what I'm hearing from this is there may be good reasons to take
Mhm.
these drugs under proper medical supervision.
Yeah.
If you're going to take them otherwise, then please consider the risks, educate yourself about what the risks could be. Don't go into it lightly. And if you do go into it, if you start taking the drugs, watch out for the symptoms that we always talk about. be aware that you could be at more risk of a blood clot.
You can read more about this on the NHS websites, but please don't procure it by any sort of illegal means. Your life is not just worth losing weight, it's more than it. And yeah, if you develop any signs of clot, as my colleague Louise rightly said, swelling in your legs, shortness of breath, feeling dizzy, having chest pains, just get seen by a clinician in the A&E or consult your general practitioner.
Thank you.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views expressed are the personal opinions of the Thrombowatch team. If you think you may have developed a blood clot, please speak to your healthcare provider urgently. Health-related information shared in this podcast, including text, graphics, images, and other material, is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent support, call 111.